Good evening to all of you who have joined the fourth webinar of CMCL-FAIMER Alumni Club on educational leadership during the COVID era. So I have with me lead faculty, Dr. Ciraj. Ciraj is course director, FAIMER Institute, Manipal. Ciraj.
Good evening, everyone.
And I have with me Dr. Purnima Barua.
Good evening and namaskar.
Purnima is from Jorhat Medical College, Jorhat. And then I have with me Dr. Ritu Jain.
Hi, good evening, everyone.
Yeah, Dr. Ritu is from Christian Dental College, Ludhiana. So, as you know, this is a time most of you are working in the teaching institutions and leadership roles are important. But this sudden and unexpected situations demands more on that. So that's why we have thought about it. Let's hand over to Dr. Ciraj.
Thank you, Dr. Dinesh. It's always a pleasure to come back to your alma mater, whether it's virtual or real. So, in today's session, we are going to discuss about educational leadership during the COVID era. I will begin with the impact that it has had, specifically utilizing UNESCO data. UNESCO estimates around 900 million children and youth, roughly 90% of the world's student population, had to stay away from schools and universities due to this pandemic. We are all aware about the nationwide closures enforced in nearly 115 countries and local shutdowns in many others. So the impact, if you look, is extending beyond the education sector. Obviously, there are economic issues. Interrupted learning is a big problem that students face, including students from health, professional education. Unequal access. Today's reports say that nearly 70 crores do not have access to this internet-mediated education, which is sad. Acceptability issues are going to be a big problem. Health professionals education, specifically medical education being conducted online. We need to discuss about this. And there are also issues related to social isolation. Campuses being the hub of socialization, people find socially isolated during this pandemic. So these are the gross impacts that we have, and it is in this context that we have come up with this specific webinar. And the objectives that we have for this webinar are the participants will be able to identify the roles and responsibilities of academic leaders during times of COVID crisis. We will also see the ways and means of reorganizing ourselves using principles of strengths-based leadership for leading and supporting our teams. I just want to emphasize here, the format that is being discussed will cover different forms of leadership, but they all will come under strengths-based leadership, which looks into the strengths of the organization, strengths of people, and how it can be channeled for the betterment. Now, this is in contrast with the commonly used deficit-based or deficiency-based approaches, where you try to pinpoint the reasons and people behind the problems. Strengths-based leadership do not really go behind those problems. It looks for the strengths of people and looks for a solution in the community itself. So as we discuss, you will see that different forms of strengths-based leadership are going to be discussed, but not with the names. For example, resilient leadership, adaptive leadership. But this session is not to talk more about the types of leadership or the functions that they do. Rather, this session basically will focus on how some of these aspects can be used in our day-to-day roles as academic leaders. For anyone who is interested more, can actually buy this or read these books, Strengths-Based Leadership, actually written by the same group that have written Strengths Finder. It's one of the very interesting and important reading material, those who are interested in strengths-based leadership. So our objectives are this, and let's go ahead. We all know that it's the time of turbulence, and many of us as academic leaders or people who are frontliners feel that they are actually in this situation, captain of being on a boat with, huge waves, tsunami around. Well, my assumptions that I have for this session before we begin is number one, each one of you who have joined here are leaders, academic leaders, irrespective of the designations that you have. We know that the leaders in academia are people who have to give direction. In that sense, all of you are leaders. So that's my first assumption. The second one is it is during the crisis that really shows, it's during the seismic changes that the characters of leaders are really shown. To some extent, we have evidence for this, but still I am putting this as an assumption. And of course, this is perhaps the only session where in this series that except for the delivery part, technology is immaterial because it is how you are going to use this. People might talk about digital leadership, which is very different. It is how you arrange your digital resources, right? But for being a leader, you don't have to be tech savvy, but you need to know that what are those technology around you so you can put the right things and the right people. So with that assumptions, just let's navigate. I want you to actually use the raising the hand function at this point of time. And at the horizon, you see a picture. Just let me know what are you seeing. Dinesh will unmute you when you have raised your hand.
I see a swan.
Okay, Sushmita sees a swan.
Yeah,
Next person.
Swan, yeah.
I'm Pamela. I also see a swan, a part of a swan.
Oh, you see a part of a swan. Okay, good.
I see it like a swan. Same.
Okay.
Okay. Now, is there anyone who doesn't see?
I see a hand and a swan.
Okay.
Okay.
Somebody sees a hand and a swan. Okay. Go ahead. Two more responses.
It's Anup here.
Yeah.
I see a swan on the hand, and the white part looks like a panther for me.
Panther.
Yes.
All right. I think that's fine. We just got our functions right, and we just wanted to see how much of Well, that is a swan, and the reason why we actually put this is to talk about a specific phenomenon known as black swan movement. It's common in the field of economics, but health professionals, educators are not very much wary about it, or not familiar about it. A black swan movement basically happens once in a lifetime, probably, or much rare, extremely rare event. And its black swan movements are very hard to predict in terms of outcomes, in terms of how it is going to shape up. It is extremely difficult to predict. Black swan movements are huge and long lasting. They're going to be there for a long time. And the problem is, with the scientific temper that we have, with the evidence-based approaches that you have, you cannot calculate what the impact is. The consequences are too serious. So that is a black swan moment. We just wanted to introduce this black swan moment because here is the question for you to actually go for the poll. Is COVID-19 health professions education's next black swan? It is yes or no. You're going to get the poll soon. Well, we are also utilizing some of the previous things that we taught in our sessions, how to make it interactive. So this is one way of doing it, the polls. 88%, nearly 90% feel that this is the black swan movement for health professions education. That's a big majority. That's a huge majority. And 12% for reasons they have, obvious reasons that they have, they say that they don't identify it. Well, this was for us to know in terms of the impact. Let's go ahead. We have seen that many of you mentioned that it's a black swan moment, but I also consider 12% who have been told that it's a black swan. This is for both of you. How do you think COVID-19 will alter the future of teaching and learning in health professions education? Obviously in higher education, but we want to be more specific because I know that 100% of you here represent health professions educations, medical, dental, allied health, and so on. So please use the chat feature to register your responses. You have a chat box there. And how do you think that COVID-19 is going to alter the future of teaching and learning in health professions education? Go ahead.
Okay, Dr. Anup Mahajan feels there will be more online teaching and learning.
Okay. More online teaching and learning. Yes. Next.
Promotes online teaching again, more of distant learning.
Immediate feedback.
Yeah.
Immediate feedback.
Virtual learning sessions.
Virtual learning sessions.
And online teaching might become a part of the curriculum now.
Okay, interesting. Curriculum, serious consideration of putting this in the curriculum.
More
And
of e-learning.
Yeah, more of e-learning. E-learning is getting more emphasis.
More emphasis on e-learning.
The fear of technology will be gone, especially by the senior teachers.
Interesting. Oh, senior or junior, we don't know, but the
Yeah,
fear of technology.
that's what they have written.
Yeah.
They will be less practical.
Pardon?
Somebody said, Dr. Supriya says there will be less of practical.
Less of practical.
Less of practical.
Okay, probably the person feels that
And
some
people becoming more tech savvy.
Yes.
More tech savvy.
It
Yeah.
promotes new innovation. It will promote new innovations.
innovations. Interesting. Innovation.
Yes. And the human touch might decrease.
Oh, okay. Which is a matter of concern in our courses. Human touch might decrease, right?
Yes.
And more
Self-directed
capacity
learning
building.
will become more important.
Pardon?
Self-directed learning will become more important.
Okay, self-directed learning becomes more important.
Disruptive learning. This is something important. Disruptive learning may come up.
Disruptive learning. Okay, disruptive learning in terms of, technology disrupting the
Yes.
thing. Yeah.
Difficult to assess soft skills.
Okay.
Yeah.
Okay.
Dr. Anshu feels that it will force us to turn to blended learning on a regular basis.
Okay. Blended learning is going to emerge. Possible.
Time and cost efficient teaching learning activities.
Okay. The introduction of time and efficient ones. I think for time constraints, we need to stop here. I see there are a lot of responses, but these are all your predictions on a post-pandemic pedagogy. That is the PPP. These are all the predictions, but this comes from a group of people who have been actually educating medical students or health profession students. So these are valid. Now, when you talk about these things, we also need to consider the context. We have seen that universities are shut down. We have seen that people have been asked to work from home. We are seeing that students have been asked to vacate the hostels. We have seen that online learning slowly has started picking up even in medical schools. So the context is important. So to bring that context, I will also share the report that has come from the Organization for Economic Cooperation and Development, which conducted a survey. I have the details of the survey in which Indian participation is also there. So look at this. It's very challenging in many times to ensure the continuity of academic learning of students. It is very difficult. At 202, you can see in this says that lacking the skills for independent study, our students do not have it. So all of a sudden it has come. So there are a number of things which you can always go through that. A framework to guide an education response to the COVID. It's available on the free domain. So challenging enough. With that challenge, I bring to you one of the very important frameworks, the Canadian framework, which is used actually for decision making, primarily in the leadership context. Now, if you look at this, you can see there are 4 quadrants. The first one is simple. You know what's happening. And in terms of, if you can see on the right side are the ordered ones, and the left side you have unordered ones. The simple situation where you know what's happening, you are guided by SOPs, you have your procedures and so on. Next one is a complicated one. Complicated one also, cause-effect relation is known. In simple, of course, it's very clearly known. In the complicated one, you know the cause-effect, but you need to probe for it. So many a times you need to do analysis, you need to take help from an expert. We move on to this side, the left order, that is unordered. That is a situation where, again, cause-effect is intertwined, unknown unknowns we call. So it might happen in hindsight. So if something happens, and then you say, oh, it happened because of this. And based on that, you create a protocol and you suddenly find out that it doesn't work for that. It is in a different way. Oh, it has not happened because of that. It's something else. So that is a complex situation. The fourth one is completely unknown. Cause-effect relationships, unknown. We call it the chaotic situations. Chaotic situations, but beware, it is the chaotic situations that brings large innovations. So, simple, complicated, complex, chaotic, Canevin framework as it is known. I have introduced this just to know your responses to our next question. What context do you expect in your educational environment post-COVID? So wishful thinking, let's say 3 to 4 months down the lane, we are back to schools. And what is it that you are expecting in your educational environment post-COVID? People have started polling. Wonderful. We keep seeing you polling. Please see that among those mentioned, and it's interesting actually because we are doing this poll among a group of health professions educators. So it's valuable to know that using a Canevin framework, bringing the context, where do you feel that your educational environment will stand in terms of the complex, while a few of them still feel it's going to be simple. It's interesting to see that majority of them, 39%, both complicated and complex. Complicated ones actually will have to rely on good practices. Complex one, you will see things emerging. And for those who actually voted for chaotic, hopefully you will have novel innovations coming up. But that's not the real idea behind this. We wanted to see your perceptions basically post-COVID using this framework of complex situations, right? Where do your educational environment stand? Thank you for sharing your perceptions with us. We move on. So based on this, we already showed you the results. But when we look the same report that I had mentioned, you also see that there are some unexpected positive results. Look at the interesting features that actually some of you mentioned are figuring here, are a ray of hope for all of us. Introduction of technologies and innovative solutions. And the second one, I'm more interested, and I see this happening these days, increased autonomy of students to manage their own learning. We have been harping on this for the last 20 years without much significant improvement. But you see that this has happened. And you also see that, of course, this study involves even schools. That's why the third one is basically on parents. But multisectoral coordinations, pedagogical autonomy, that people are trying every sort of things to see that their students are engaged. I'm talking about the teachers. Societal interest, and of course, a whole lot of things. So I thought that this quote actually gives an insight to what I projected there. In 1665, Cambridge University closed because of plague. Isaac Newton decided to work from home. He discovered calculus and the laws of motion. So laws of motion and calculus being discovered in a time of a pandemic. So that gives hope. With that, let's quickly go through the tips that we have as leaders. We mentioned in our objectives that is to reorganize. So these are the tips that we had in this limited time that I have to, when you have to navigate in this turbulent period. And you know that in the past, navigators relied on constellations. And I'm going to use 7 of these stars to basically address the issue that we have at hand. The first one is anchoring yourselves. Second one, a people-centered approach. People are everything. Third one relies on communication. Fourth one is looking for bright spots. Fifth one, getting on the balcony, which some of you have already done. Regulating distress. And finally, designing from the heart. Let me go to the first one. The first tip for navigation is anchoring yourself. A leader is expected to anchor yourself in turbulence. You are familiar, some of you at least are familiar with the 2 circles that Stephen Covey highlights in his seminal piece, The 7 Habits of Highly Effective People. The outer ring is circle of concern, where you have absolutely no control of what happens. The inner circle of influence, where you have control of what happens. Circle of concern is where many of us dwell in times of pandemics or in times of insurgency or in times of turbulence. Now, what are the possible things that can happen? I see that this is what many of them in general public keep in terms of circle of concern. Oh my God, what's happening to economy? Look at the way politicians are behaving. What is happening in other countries? So many are dying. Why are these some people behaving in a way that it's not a pandemic? How long is it going to last? Nothing. None of these basically are under your control. But you become too much paranoid that you will see that you become a reactive person. Leaders can't be reactive, at these circumstances. And you will see that your circle of influence shrinks because your circle of concern slowly becomes big. Except for lack of PPE, I meant for public person, but for somebody who is a frontliner, it is a concern. I'm talking about people, otherwise generally if you take, these are nothing to do with them, and they have, of course, you can always keep a genuine concern, but these are not going to really influence the outcome. So, I want you to reflect at this point of time. No answers required for this. Where are you currently spending the majority of your focus and time? We are doing the first tip, that is anchoring yourself as a leader. Are you spending your time in circle of concern or influence? No answers expected. But I need an answer for this, which you are going to give me in the chat box. That is, what will you do to expand your circle of influence during COVID times? Go ahead and write in your chat box. How or what will you do to expand your circle of influence, which is what the leaders are expected to do, so that we can slowly make the circle of influence bigger and bigger, and the concern becomes smaller. So go ahead. What will you do to expand your circle of influence during COVID times? And as you record your responses, Purnima and Ritu will share this with me.
Engage in read.
Up new skills.
Pick up new skills. Very good.
Self-learning.
Self-learning. Excellent.
Development.
Yes.
Creative.
New skill perhaps, creating online teaching and learning. Go ahead. Networking, excellent. Yes.
Support colleagues and students.
Supporting colleagues and students. Yes.
Learn and then share.
Yeah.
Contacting students and discussing.
All right.
Learning and sharing new skills.
Learning and sharing new skills. I see many of them will be actually based on that. For time constraints, I will just share with you, and I'm sure that many of you have this. Look at the way you could expand your circle of influence. Things
Majority are coming up with learning new skills.
Exactly. So learning new skills, and that's what people have been doing. Finding new ways to stay in touch. The person talked about networking, keeping in connect with others. Look at the one to limiting social media and news intake. Many a times, this is the real reason for the worry. So this is something that we have put up. You may have your own thing. I see there are people even in social media who are only at positives. They simply ignore negative things during this pandemic. They just post positive stuff. So then if I have to be a real role model, I will see that I actually do social distancing, hand washing, and this is my neighbor who doesn't care. I need to model and say, look, you got to do this so that my influence, circle of influence grows, helping others, as people said. So let me bring this into the context. We are now discussing what academic leaders will do in the times of COVID. So first, take care of yourself. That is, anchor yourself. A leader who cannot anchor himself cannot really actually give direction for others. You have heard often in the flights, before you actually help somebody, put on that mask yourself, right? It's the same thing that holds good here. So that is our first tip for navigation. So you are not a product of your circumstances, you are a product of your decisions. So keep that in mind. And with that, I also want you to introduce a book called Forged in Crisis, written by Nancy Paul. She's a it talks about 4 important things. When you are a leader, you should have a worthy mission. And for most of us who are involved in health professional educations, in the delivery of healthcare, we have this, but the idea is to get self-motivated and say that, look, I am on a worthy mission. Being thou-centered. There are different kinds of leaders who give actually prominence for their own self-vested interests. We have seen many of them. But in the times of crisis, and basically, when you talk about strengths-based leadership, it is about taking care of others, being taking care of others. Never doubting your capabilities. Many a times during crisis, issues, debates are raised. Sometimes you yourself feel, oh, look, am I capable of? Never doubt whether it is others, or otherwise where it comes from yourself. Never doubt your capabilities. And finally, she also talks about, actually in this book, she talks about 5 people. One is Abraham Lincoln. If you want, you can read an interesting read during these times, basically how courageous leadership actually worked in turbulent times. The last one is helping others overcome their limitations. Have you heard people saying, look, if she had not intervened at that point of time, I would not have come to this position. Look, if he had not helped me at that point of time, I would not have. So, the idea is a leader who will help others overcome others' limitations. Well, that was the first tip. We move on to the second tip, that is the people-centered option that we have. People are everything. And to elaborate on that, I will invite Dinesh, who is actually managing, and I can say even the country lead for the CISP program, and who also actually is the director of CMCL-FAIMER Regional Institute at Ludhiana. Go ahead, Dinesh.
Yeah, when you have asked me to see about this, people are everything. I look back the role in which I am leading at certain positions. When I look back, I see there are people. Because of that, you have those position leadership. So people are everywhere. Even in the present context where we are there, people are getting affected, but people are managing. Remember that. They are taking leadership roles. They are also there. Lot of other leaders right now, maybe you don't see, but people are everywhere. So in any leadership position, we need to identify the strengths of these people and see how we put them into various perspectives. So that is something I see is very, very important.
Thank you, Dinesh, for that. So in the beginning, we mentioned about, can you see me? Yeah. In the beginning, we mentioned about how important these, tips that we are giving are in terms of strength-based leadership. So he highlighted the importance of basically people, how important people are. Now, I will narrate a story, and then it is just not about the people whom you have. That is absolutely important. For a leader, it is also important to choose the right people for the right job. You may call it delegation, but it will be trivializing it when you say like that. This is a war room story where a general actually is going for a war. And he's a little doubtful about the outcome of that war. So what he does is that he calls 3 colonels who actually are leading the battalions. So the first one he calls, the first one comes in, and to the first one he says, look, we are going for a war tomorrow. And this first one is a micromanager, the first colonel. And you know, micromanagement is actually exactly opposite delegation. You go and look at every single stuff, you know. So general says, the general who had actually anxiety about winning the war on the next day says, look, most of the things have been done, but I want you to closely examine all possibilities so that we win. And he being a micromanager, that was the thing that he was looking for. And he would have probably gone and checked every single thing once again. Then he called his second colonel, who was an entrepreneurial leadership skills, who actually probably will go out and do out of the box things. And, you know, and the general said, look, Colonel, I'm very sure we are going to win the war tomorrow. But you can always have your free hand to win this war as you have done before. Even this colonel went back because he knew that he was getting all support from his general and could use all the innovative ways out to win the battle. And the third and the last colonel came, and this guy was basically a little bit cynical, a counter-dependent, I could say. When you say that, you know, now it is night, these people say it is daytime. When you say it's blue, they say red. So he told his general, look, tomorrow we are going for a war. And I'm afraid that we may lose this war, because this war is basically very tough for us. And I'm extremely worried that we may lose this war. And you know what this person is going to do. This person will try his level best to see that the war is won, because his general has told we will lose the war. So, and obviously all the 3 colonels use their own strategies and they won the war. So when you have to give the example of choosing the right people at the right time, I use this story of how actually you can use the strengths of people basically to get these things done, specifically during the time of crisis. Well, this is the third tip. It's about effective communication. It's all about effective communication, because effective communication is about leadership, or effective leaders are effective communicators. Now, I've just termed it COVIDian communication, for want of any other name. So what are you going to communicate? You got to communicate the impact that this particular crisis will have in your own settings. You will have to have the plans displayed. At the same time, you will also talk about what are the benefits that have been kept for the people around you and the expectations that you have. How do you communicate at this time? It's about being very transparent, absolutely no false statements, make it very clear, and also the way it will actually bring down the anxiety levels of people. When do you communicate? As and when required. Many a times as soon as possible and as fast as possible. Because you have seen that the best leaders who have emerged during this pandemic are those people who have communicated to length, who have actually communicated frequently. Now, this has to be in a phased manner. While the first communications basically will talk about the support that you have and your commitment that you have to your people, slowly you will move on to decisions that you're taking. Look, we are going online. Look, there's a faculty development program that we have kept you how to teach online. Okay, look, so this is with flexibility within the constitutional system that you have. And the third part is where you're going to be tough in terms of, you know, whether you lack resources or when you're talking about financial issues or when you're talking about, and this should come last. Sometimes some leaders make the mistake of actually reversing this, and that causes a lot of pain. So that is about the communication. But somebody who is teaching and actually involved in the academic arena I'm just asking Ritu that what will you communicate or how will you communicate with your immediate stakeholders? Go ahead, Ritu.
Yeah, see, the immediate stakeholders are our students. So probably all of us have been asking these critical questions to ourselves and amongst each other for the past 1 month. How do we teach our students in this time? There are so many platforms available. Which platform do I use? When I'm using these online teaching platforms, how do we engage our students? How do we make sure that the students, are engaged in the teaching or the learning? How do we communicate the change to our students, to our faculty, to our colleagues? And how do I encourage, interaction? How do we assess our students? So all these questions are critical, and we need to ask these questions to ourselves. And probably we all have been thinking about these questions in the past few weeks.
Thank you, Ritu. So if you look at these questions, it's actually it's very interesting for particularly me and Dinesh, because if you look at those things that have come up there, that is where we have tried to develop our faculty in terms of introducing them to online platforms, in terms of how do you make it interactive assessment of learning. But these questions, if you look at these questions, they are basically focusing on a very specific domain, obviously teaching learning. But these questions are technical and they have answers. I'm going to introduce you to another form of questions, specifically when you have sticky issues, when you have wicked issues, when you have turbulent times, that is adaptive questions. Adaptive questions will not have clear answers. Adaptive questions, for example, is technology enhanced learning going to enhance the competency of medical graduates? There is no single answer for this. Deeper questioning of our assumptions and values. You will see that sometimes what we wrote in the rule book has to be discarded. The rule book has to be thrown out because it doesn't work in COVID. And adaptive questions is where there is tolerance for divergent views and uncertainty. Imagine a few months back, if a faculty had told, let us do this online, we would have thrown him out of department. Today, we can't do that. So tolerance for divergent views and uncertainty. What we're trying to tell you is, in terms of communication, adaptive form of communication. Technical is important. Technical is where you get answers. It's not that technical is not important. But as leaders, we may have to ask adaptive questions, questions that may not have clear answers. Never mind. But you have to ask this your teams and then evolve. All right, we go on to the next one. That is the fourth tip that we have. That is, look for bright spots. You will see that some people, in spite of all the problems that is there in this time of uncertainty, they do well. Some people, some organizations, some groups, in spite of all the problems. Now, I'm introducing you to a concept known as positive deviance. Positive deviance is where, in spite of all turbulence, in spite of all constraints, including resources, some people do well. It is the study of Sternins during, it was based on nutritional studies. It was based on the study that was carried out for malnutrition. Sternins found that when the World Bank resources got depleted, they were doing this work in Vietnam. They found that some kids, in spite of the same condition that was prevalent in the whole Vietnam, some kids looked well nourished. And then they conducted interviews with the parents of those kids and found that they had some practices, unusual practices, of feeding them in between, providing some conventional food, wheat, shrimps, which acted as protein sources for these kids. So they actually did not suffer from malnutrition. From there came the concept of positive deviance, which means that even in very grim circumstances, there are people, there are groups, there are organizations. And we have seen that happening in this COVID era. Even in education, there are people who have been doing it. So follow the positive deviance. And that is our next, tip, navigation tip that we have for you. For anybody who's interested, this is a must read for those people who are interested in the power of positive deviance. Positive deviance is an approach, basically, and it is an asset-based approach. It utilizes what is already there in the community. It doesn't come up with something that is totally new. With the things that is available, some people actually reach excellence. So that is the fourth tip among the 7 tips that we mentioned. We move on to the next one. Get on the balcony. I'm sure that many of you already went there, applauded for the doctors and health professional workers. Some of you, probably would have made noise with your vessels. But this getting on the balcony is different. This is getting a view of what is going to happen, especially during crisis. And again, I want Dinesh to go on the balcony and share with us what was his balcony experience.
Yeah, this has been something very interesting because routinely when I do my work in all these positions these days, I work with a lot of people, even online or work from home. So working, people are working, I'm supervising. But sometimes I get out of that. So if that is my dance floor, I come out of that room, go to my balcony and visualize what next, how it is going to continue. So next 6 months, 3 months, 1 year, how I have to handle all those people, all those tasks which are there, strategies, not putting up so much of pressure on those people too. Okay. So I'm looking at or those, you can say, adaptive changes or adaptive challenges, both. Looking at a bigger picture. So that happens when you go out on the balcony. But number of times when you are on the dance floor or in the working space, you keep on working. But getting onto the balcony gave me that vision, which tells me, okay, now I have to go at further steps. Look at the bigger picture. That gives me an idea how I need to place on that. Because no, these are uncertain situations. So getting on the balcony gives me a lot of idea about bigger picture and to plan for that farther side, you can say. Yes, Raj.
Thank you, Dinesh, for sharing that balcony experiences. Now, as you rightly said, it is just not that you go onto the balcony, look, COVID is coming, it's going to impact the way that education is going to be delivered. So it is also important to come back to the dance floor. You got to come and see what's happening there. What are people talking about? And when you are a leader, sometimes you will also hear that people would have told you that, look, what you decided is not right, or whatever you decide is not right. Or somebody would say that, no, this is a better way. So getting on the balcony, being adaptive, and at the same time, coming back to the dance floor, communicating with your people, it's equally important. So that is the next tip or next navigation tip that we had to give it for you. The next one is, in times of uncertainty, distress is common. So it is very important as an academic leader, you regulate distress. I'm inviting someone who was actually roped into the COVID team to head the team and to become the medical superintendent, just on the eve of when the COVID, really came as a grip of fear. So it is for Purnima now to share the next tip related to this, that is, how do you regulate distress?
Yeah. Thank you, sir. Well, this charge came to me in a time it was very, very crucial. And my first thing, which when I got into the dance floor, the first thing was to provide the safe environment for all the people working here in this hospital. And initially we all were clueless actually what is going to happen. We did not have a positive case, we still do not have, but our nearby district is affected. But providing a direction was very, very important, and that is when, and how to provide the direction, it was getting all the people on board. They were already there, but it was just giving some direction to them so that we know what to do, and if in case a positive patient comes, how we are going to work. That was one thing. And simultaneously, actually, it was a multi-pronged thing, direction, protection, and orientation, managing conflicts. All this was happening at the same time. The first and foremost and important thing was to allay their anxiety. All the healthcare workers are basically very, very anxious about, because nobody knew. There were so many myths. There are so many, I have seen this is one other virus, or the second virus after HIV, which is inflicted with so much of stigma. So that was one thing that as a team, we had to allay the anxiety of all healthcare workers, especially in terms of that assuring them that they will be provided with PPE or the N95, taking care of the IPC training so that infection prevention and control is managed, taking care of where they are going to be quarantined, how are they going to stay, and during the duty hours when they cannot come out, whether the food will be provided, etc. These were things, basically understanding their vulnerabilities and addressing their concerns was one of the main thing. And finally, the most important again was managing conflict, which arose or is still arising at various strata at various times and among the different group of healthcare workers. So, and strong shaping of the norm. See, this is a time when people are very, very anxious. They are very, very vulnerable. And at the same time, keeping the regulations or adhering to the regulations also become very, very important. So that balance became very important, or has become very important. And communication has played a very important role over here. Communication among the rapid response team, among the lab, within the administration and the healthcare workers, so that the information what needs to be given is actually um, uh, given out in, and making courageous decision is another thing which I have faced. There were particular times when a strong stand has to be taken from the administrative point of view. And finally, as we say that a leader is as good as the people are. So we have a very strong team. That is a good positive point. And to keep that, maintain that team spirit and teamwork is very, very challenging. So these are a few of the things, and moreover, this was from the healthcare workers' point of view. But again, regarding how much protection are we going to give, or facility are we will be able to provide to the patients, that's another concern. And considering, if we have disabled patient, what are we going to do? These were also the things that we had considered. And finally, demonstrating that personal presence, yeah, definitely it is very, very important, because this is a time when as leaders, we cannot get distressed ourselves. That we have to allay their anxiety, and the more poised, the more confident, or the kind of assurance that we give. And it is not just verbal assurance, we actually make it. That, yeah, this will be done, we are there with you, just go ahead, and you are a frontliners. These are some of the things, where we have to ascertain them with all these things. And so this is a moment of complete uncertainty, frustration, and there are pains. And another important thing that we took care of is the healthcare workers who have any kind of comorbid condition themselves, like diabetic or anything. So they were completely removed from this COVID hospital of ours. So a lot of reassurance was provided.
Thank you, Purnima. So, as academic leaders, it's very important that when there is uncertainty. Now, we had Purnima actually, who is along with frontliners, but many of us are not there. We are actually, but we do have our teams. When you're talking about an educational environment, and then when we go back, and many of you voted, 39%, 39, and another 12 who said chaotic, except for very few who said it's going to remain simple. It's very important that we try our level best to provide a safe environment to our students, to our fellow workers, and also demonstrate emotional capacity as leaders. With that, we move on to the last one, that is, design from the heart, the head will follow. Unfortunately, the norm has been to listen to the head. But in trying times, in uncertainty, in chaos, we need to design from the heart. There will be times when people come and ask you for excuses or provide you excuses, or they're going to tell you this, kindly pardon me for this because it doesn't work in this situation. Now is a time for you as an academic leader to use your heart. The head can follow, but what we are talking about here are leaders with heart, academic leaders with heart, who will give importance to emotional aspects. Somebody would say, you're talking about emotional intelligence. Yes, fair enough. All we want you to follow is, as a tip, please don't go by the head. You got to actually start involving the heart during this time. It is extremely important to be a compassionate leader. So it is time to adapt. That's what we are trying to. So we could just give you a few, tips for that. Designating a team basically to oversee the development and implementation of alternative education strategies. Keep communicating with all stakeholders. Don't forget to involve your students. That's a mistake that we make. Why should they know? No more. In these times of uncertainty, students also have to be roped in. Now, listen to me carefully what I'm going to say. Some of you probably will not agree with me, and I don't want you to also. But I feel that a time has come to reprioritize our curricular goals and develop a continuity of operations plan. If COVID is here to stay, then there may be a requirement of a shift in curriculum or a departure from standards. How do we do this? We got to do this as a community. We need to communicate with all the stakeholders, with all other medical schools, with all other people involved in the delivery of how things have been working for them. It's a time to curate high quality resources at national level, state level, organizational level. We could even consider crowdsourcing as long as the content can be thoroughly vetted. Prioritize the well-being of both students and staff. Actively pursue innovative partnerships. Share ideas to see how learning can be made sustainable. Again, it's my plea to allow for regulatory flexibility. During times of complicated, chaotic circumstances, regulatory flexibility and also leniency on certain standard procedures. For example, you can just keep it latent for some time. First, let's address this issue. Let's see how well we can actually take care of our students, how well we can take care of our patients, how well we can keep this interest of the nation high. So that is what we need to think as academic leaders at this point of time. Well, if you just look at qualities a leader should have, you see that it's not surprising that everything in COVID era starts with C. I'm just showing some of those which I found interesting and did find and did not find in many leaders, maybe internationally, nationally or locally. I'm not going to take any names, but as academic leaders, stay calm, display confidence, communicate thoroughly, frequently, collaborate with as much as people you can. Be creative because that's the need of the hour. Be creative and conviction. I don't think that a leader without conviction is actually going to influence people. For me, conviction is very important. Equally important is compassion during hard times. But the last one is where I want to focus. As leaders, as academic leaders, we need to function as communities of practice that Wenger mentioned. These are a group of people who actually have an intention that is similar and they share resources and then they have their networks. So it is an emotional bonding at the same time an intellectual union. So we should become these communities of practice and academic leaders have to initiate that. So that is what we had to share with you. So this constellation, when you actually link as a navigation tip, we said anchor yourself, take care of yourselves before you take care of others. It's a people-centric approach. People are everything in this. Effective leadership is effective communication. But in these times, communicate frequently, communicate with passion, communicate sensible things, and that is transparent. Be transparent. Look for the bright spots. I gave you one example of actually positive deviants who do things different in these difficult times. Get on the balcony, get the perspective, but don't forget to come back onto the dance floor, share it, and then again go on the balcony. Regulate distress, extremely important when you have people with you. And the whole thing basically revolves around those four chambers, designed from the heart, and that is required during the COVID period. So these are the tips that we had, gentlemen, ladies and gentlemen, that we had for you in terms of navigating these turbulent times. And thank you so much for being a part of this webinar. We see lots of hands raised. We would be happy to entertain some of your questions within the limited period of this session. Thank you so much. On behalf of all my panelists, thank you once again. Does it make sense?
Yeah, it makes sense. And yeah. So it also says like when you go to the balcony and come back, then we can always look at the bright spot. That is, with the assets we have, we should be able to do what we saw there in the balcony.
For all these things, the channels of communication have to be wide open.
Okay, thank you so much.
So
Thank
Dr. Pamela, is like looking back at your resources.
Yes.
You get an idea when you go to balcony, come back to your working space.
Okay. Yes.
Share the idea with the people there. See whether they are responding to that or not. It might be just your idea. Remember that it has to be idea of the team. Then they will take it.
And it's workable. Yeah. Thank you.
Yeah. So Purnima and Ritu, you have still any pending questions from the chat which were there earlier? If you have something main concern.
Not really, sir. No more questions as such. It's just the comments which are coming up.
Okay.
So basically, everyone, most of them have liked the concept of design from heart and head will follow.
I think most of the points we discussed, you have actually practically gone through that in the last.
Yeah, exactly, sir. Exactly. So all the tips which sir gave, and surprisingly, this was what unknowingly, this was what is being followed or what was being followed.
Yeah.
Yeah.
So if there are no more questions in my private chat, I can see at least 10 of my friends who have told your shirt is glistening. I can't do anything about that. I also see that, glittery and glistening. I will do a research. I'll do a research and see what makes it glistening or what makes me a bright spot today.
It's a virtual background
of fluorescent.
Yeah, fluorescent.
So what is happening? The leaders who are like that, they start because shining like this. So that's we told, if you imbibe those qualities, you will also start shining in your field. And you will see your shirt will also behave like that.
It could be virtual or I don't know. I'll do the research and find out.
Yeah.
Thank you for your questions. All these questions are very valid. And it is very important for us because post-COVID, don't think that decisions can be taken in the confinement of 4 rooms by some organizations, some people know. You are the stakeholders and you will have to give your inputs as we evolve. As I told you, as teachers, as medical educators, as health professions educators, as health professionals, we have a big role to play in nation building. That is true for any nations, but it's time for us to actually, work together. And we have only one enemy at this point of time. That is something that has to be made very clear. Don't be divisive. Don't go by any divisive tactics. People will try so many things. We have only one enemy, that is COVID. So let's unite against COVID, use all our resources against COVID, and actually we are very sure that like many of those battles that we have won, we will win this war. Thank you.
Yeah, so in fact, Ciraj, when you talked about that, and it reminds me back of the words you have used, chaotic, complicated, complex, and simple. See word over against the same enemy, how the various leaders, which were very well-known leaders, how they have behaved. Some of them sustained, some have, you can see, has progressed more, some could not handle it. Remember that those are the situations we are talking about. Those are the points we are talking about. That
Hello,
And
Anna.
even exactly your institution might have a similar
Ah.
situation.
Sorry.
Remember that some of the others may be trained leaders, you might say, and
Yeah.
some other who are adapting presently based on the present circumstances, how they are behaving in this situation. You have somebody there? No. Yeah, so that's what I wanted to add on to that.
Yeah, and CMCL has played a very important role over here.
Yeah, we thought about why not. If we have trained so many people, it's time to give back to society. Let's get together.
Right.
We are the people only. Remember, we are the people only who are getting collected. Let's get together.
People are everything.
Yeah, people are everything. Give them leadership here. You can see a lot of people we have given leadership here, and they are doing tremendously well. They are following all these principles. That's what we are just trying to put them together.
So thank you so much.
Yeah, thank you everyone. Thank you so much.
Thank you and good night.
Thank you.
Yeah, closing now.